Norovirus was first discovered in 1972. It was identified following an outbreak of acute gastroenteritis at an elementary school in Norwalk, Ohio in 1968, which is why the original strain is often referred to as the Norwalk virus. The virus gained its current name, Norovirus, as part of a broader classification of related viruses. Norovirus is highly contagious and spreads primarily through the fecal-oral route. The most common mode of transmission is direct person-to-person contact, which involves the transfer of the virus from one individual to another through touch or caring for someone who is ill. The virus can also be contracted by consuming contaminated food or water. This usually occurs if food or water is handled by someone who is infected and hasn't washed their hands adequately, or if it comes into contact with contaminated surfaces or environments, such as oysters harvested from contaminated waters. Another route of infection is through contact with contaminated surfaces. Touching objects or surfaces that have been contaminated and then touching the mouth can lead to infection. The virus can survive on surfaces for extended periods, which contributes to its rapid spread in communal settings. Although less common, norovirus can also spread through aerosolized particles when an infected person vomits. These particles can be inhaled or land on surfaces, creating new sources of infection. Given these varied transmission pathways and its low infectious dose, norovirus outbreaks are frequent in closed and crowded environments like hospitals, cruise ships, and schools, where it can quickly spread among large groups of people. Norovirus infection typically leads to acute gastroenteritis, characterized by a range of symptoms that usually develop within 12 to 48 hours after exposure to the virus. The onset of symptoms is often sudden and can be quite severe. The primary symptoms are gastrointestinal, with nausea often being one of the first signs. Vomiting is particularly common and can be intense, especially in children. Adults are more likely to experience profuse, watery diarrhea. Accompanying these symptoms are stomach pain and cramps, which contribute to the overall discomfort. Beyond these gastrointestinal symptoms, individuals might also experience a mild fever, headaches, and body aches. These symptoms generally contribute to a feeling of being unwell. The duration of these symptoms is typically short, lasting about 1 to 3 days. However, the rapid loss of fluids from vomiting and diarrhea can quickly lead to dehydration, which is a concern especially for the very young, the elderly, and those with compromised immune systems. Indicators of dehydration include decreased urination, a dry mouth and throat, and dizziness upon standing. Managing hydration is crucial for recovery, emphasizing the need for plenty of fluids and rest during the course of the infection. Treating norovirus involves managing symptoms and preventing dehydration, as there is no specific medication to cure the virus. The mainstay of treatment is maintaining hydration. This can be challenging due to symptoms like vomiting and diarrhea, but it's crucial to drink plenty of fluids such as water, broth, and oral rehydration solutions. Caffeine and alcohol should be avoided as they can exacerbate dehydration. Rest is essential for recovery, allowing the body to fight off the infection effectively. When it comes to eating, sticking to bland, easy-to-digest foods such as toast, rice, bananas, and applesauce can help manage gastrointestinal symptoms. Spicy, fatty, or very sweet foods should be avoided as they can irritate the digestive system. It's generally advised to avoid over-the-counter anti-diarrheal medications unless they are specifically recommended by a healthcare provider, as they can sometimes prolong the infection. Good hygiene practices are crucial in controlling the spread of the virus. Regular hand washing with soap and water, especially after using the restroom and before eating or preparing food, is vital. Surfaces that might be contaminated, like bathroom fixtures and kitchen counters, should be cleaned and disinfected regularly using bleach-based cleaners, as norovirus is notably resistant to many common disinfectants. Monitoring for signs of dehydration, such as decreased urination, a dry mouth and throat, and dizziness upon standing, is important. If signs of severe dehydration appear, particularly in vulnerable individuals such as the elderly, young children, or those with other health conditions, seeking medical attention may be necessary to receive treatment, potentially including intravenous fluids. These measures collectively help manage the illness and prevent its spread to others.